Good morning everyone, and thanks very much Evelyn. Just for those that may not know me, so my name is Michelle McNally and I'm the Family Support Coordinator with the Finglas Cabra Local Drug and Alcohol Task Force. Sorry, we're in her back here. I'll let Sarah Jane introduce herself.
My name is Sarah Jane Leonard and I'm the Family Support Coordinator with the HSE Social Inclusion Addiction, covering Dublin North City, Dublin North County, Dublin North City and West. And I've worked with Michelle for many years on the family support strategy.
Take a breath after that introduction.
I know, that long.
Thanks, Sarah Jane. So why are we here? So I suppose myself and Sarah Jane wanted to update yourselves on what we've been working on, along with a lot of other stakeholders across the areas in relation to the family support strategy and quality of standards. So really, the purpose of today, the session purpose, will be to align with the family support strategy. Just over a year ago, it would have been last January, we held an event in the Reece Centre, and that was to bring various organisations together like today, but today is more localised in terms of local services, and I see many of you here today, which is brilliant. So we met, and we'll go through who else was involved in this process back in 2022. Yeah. So we're 3 years or so in looking at building this strategy and the different stages, and we'll go through that as well in terms of the initial stages, the defining, design and the implementation. So we ourselves, an implementation group, as I said, met numerous times over those 3 years, and it's just really to give an update as to where we're at now and the strategy that's being produced. I suppose family support has been around for many, many years, and you know, we didn't have a strategy as such in terms of a framework. So I suppose the whole aim of this is to look at the standards, look at the principles, and how we best in terms of that collaboration piece can look at meeting these standards, and we're all already doing, you know, that, and it's just, I suppose, looking at that framework to guide our work and I suppose best practice and evidence. So essentially that promote excellence within the different services. As I said, it'll be to outline the key principles within the strategy. And really the purpose of this is to standardise family support across the area, and essentially that's why this framework, it's the same with Evelyn had mentioned there, the National Drug Strategy, other strategies that we have that inform our daily practice. So this is a framework for family support and essentially to enhance service provision across the board, and we'll go into detail more in terms of what those principles are and quality of standards. So really just, I suppose, I've touched on this, that alcohol and drugs, as many of we know, does impact, has profound impact on individuals and families. And one of the things we'll touch on is one of the evidence-based interventions, the 5-step. And that, I suppose, is to support family members affected by a loved one's substance use, gambling and gaming, and we'll touch on that too with those additional pieces. So really it is about that coordinating approach and to standardise family support across the areas, and to provide guidance and leadership as well, as I said, around those evidence-based interventions, which we're all doing. So yeah, I'll let Sarah Jane just go into the define.
Click for me.
Oh yeah, sorry.
Thanks, Michelle. So yeah, just to carry on from where Michelle has kind of given you an overview. So there was a process. We did meet pre my post in the HSE. We had started to meet in 2022 around those coordinators in local task forces and a regional task force. So how are we doing this, and what gaps, to identify any of the gaps that were there, but also to look at the service provision that was being provided across the region or the areas. We used a model called Define, Design and Deliver, and that process is around defining change within services and reviewing what's currently happening. As Michelle said, family support's been happening for many years, so it wasn't about going in and kind of redoing stuff, it was looking at what was going on. So we identified a shared purpose, and we used this process in order for us to move through it kind of in order in terms of the implementation piece. So we need to understand the current services and agree better outcomes. So we done a mapping exercise, and thankfully when I went into the role in the HSE, the national office had just done a mapping exercise. We were able to kind of dovetail on that piece and within the addiction services. So we focused particularly around what was happening within family support in the services in each of the task force areas. So we looked at making a case for change and, you know, looking at the evidence, what's available to us, how can we improve the standard of practice, but also to improve the service provision for our key people, which are family members. Then we moved into a design stage. So once we gathered all the data, we were able to see what was happening across the board, and it reflected what the national office had found. It was quite inconsistent. So if you lived in one area, like if you were in Finglas, Cabra area, you had a dedicated family support service, but if you lived in another area, you may not necessarily have access to that. So together we created a plan. Now we pulled it together ourselves, but so we tested it out within each of the task force areas, and in July last year, we actually had the final document where we moved into a stage where we were implementing the actions and all of the information that we had gathered over the two years previously. We're still in the early stage of delivery. We have the document. Michelle will share that document with the services in the Finglas Cabra area. But within the task forces, they've been using this document since July last year, and it is a very interactive document. But I suppose we use this model because it kind of made sense to us. We needed to define what was happening already, co-design, and then move into an implementation delivery stage. So why family support matters? So Michelle just mentioned there, family members are significantly impacted by substance misuse within the family. And for every one person that uses drugs or alcohol, there's a minimum of 4 people who are affected and up to 20 people. So we know there are a lot more people out there that we aren't reaching within our services, and how do we make our services more accessible and equal to all to access. So the impacts include, I know I'm not going to teach my granny how to suck eggs, a lot of you know what the impacts are. So it's that emotional distress, the health problems. So when people experience stress, and this is what the 5-step, Michelle will talk a little bit more about that, when people experience stress in their lives and for long periods of time, it does have an effect on them physically, and their health can become affected because of the stress. The financial strain is a big one again, and particularly if there's drug-related deaths or intimidation. The whole stigma that goes with the addiction piece, the isolation, and generally family members don't look for support until things are extremely bad. So they're in quite kind of chaotic situations. So they might have exhausted all of their family support or family connections that they may have, and they start to isolate themselves from community, stop doing things, all of those things, and that's what the research shows us. So in other cohorts, our children, young people are hugely at risk of harm and adverse outcomes. So we've taken into consideration the hidden harm guidelines in the document, and we've kind of weaned that in throughout the document. Family members often seek help independently, so even though their loved one may not necessarily be engaged in addiction services, they will reach out for help quicker for themselves because they may not know what to do. And historically, again, just to say, access to consistent family support has varied nationally, not just within the task force areas that we looked at. So what did we use? So we had policy and strategy context. The quality standards is aligned with Sláinte Care Reform Programme. Everyone's heard of Sláinte Care? Yes? So Sláinte Care is the HSE reform programme where people have access to services in their community. That's just one part of it. So this document is aligned with the Sláinte Care Reform Care, the HSE National Service Plan, Hidden Harm Framework. Again, there's training available for people, even though services may not necessarily work with under 18s. We need to be taking that whole family approach in terms of having better outcomes for family. And then we looked at international best practice in family-focused intervention. So there's a lot more available internationally rather than nationally. They're informed by the Health Research Board evidence. Thankfully, I came in just when the HRB had completed a 10-year study on concerned persons that were uploaded onto the HRB link system. So we had a lot more data where we were able to see what family members' needs were and what was best and the outcomes that they had. There was Irish and international research on family intervention, so we looked at all of the evidence-based interventions that were available to us, 5-step being the focus of our strategy, and for services who provide services to under 18s, it was steps to cope. So we're in that kind of capacity building stage in the implementation. So again, through the work that we've been doing over the last few years, we had close connections with AFNet UK, so Alex Capello Development, Richard and Jill and Lorna Templeton had done way more work than anyone done across the world, so just to kind of look and review what they had been doing. And they are the founders of the 5-step model. So the hidden harm research on children and families, again, all of that was pulled together. So traditionally, the services, when we done the mapping piece, there was a lot less services offering support to children who are affected by substance misuse. And then the service user consultation and practitioner experience. So what we done was, we done a training development needs analysis with managers and leaders in services, and then each of the coordinators then went to practitioners to talk about what they needed in terms of building capacity and enhancing service. I just want to say our service user consultation has been like fundamental to this. We have a service user who sits on our implementation group who has been really, really key to that, and using the support programme, the data that comes back from the service user participation for family support has been used throughout this document to design the piece. Again, quality standards aims to standardise family support provision nationally, ensure equitable access to evidence-based intervention. So everyone, no matter where you live, if you're affected by substance misuse, that you have access to services to support you with that situation. To clarify service levels, pathways and referrals. As I said, it was quite inconsistent. So some services were doing all of the work and some services were doing brief intervention, some services were signposting. And a part of my role and Michelle's role as part of the implementation group is to support that consistent monitoring, evaluate what we're doing, always learn from it and kind of make improvements as we move through. We're on version 1 of the strategy, so maybe in a year or 18 months time when services get used to the strategy, we'll have a version 2. So we're working on a communications plan at the moment within that group. So just in terms of how did we go about this? So what we done was we gave a questionnaire to services who were commissioned through the HSE to provide services in communities. And we looked at the different types of family support that services were offering. So you may have a dedicated family support service like Michelle's in Finglas, Cabra, and Rachel and Sarah and Mary. So we asked services, how would they describe their service? So are they working with family members to promote the entry and engagement of substance misusers into treatment? So that could have been some of the addiction services where a family member comes in and then someone comes in for their episodes of treatment. Is it the joint involvement of family members and substance misuse and relatives at the end of someone's treatment? So if somebody could be going through like a 6-month, 12-month programme, and then they bring the family members in to look at the recovery and the new part of the journey. And then, as I said, interventions responding to the needs of family members in their own right. So technically, that's when we get people into the dedicated family support services, because they're looking for support themselves, and that's what we were promoting. Michelle.
Yeah, so I suppose we wanted to make sure that, like, okay, well, what's our vision? That was a question we asked ourselves. It's same in every organisation when we're doing strategic plans or just our own ethos around organisation. What is our vision? So our vision in relation, when we were meeting as an implementation group, as Sarah Jane said, it's family members being recognised as individuals within their own, their own needs, and particularly the 5-step intervention is essentially that. The beauty of it is where family members are needing support in their own right, because as I'm sure you'll all agree, we don't live in a vacuum. So a loved one that is engaging in substance use gaming or gambling, that is going to have a profound impact on families, whether that be physically, emotionally, mentally. So that is part of our vision. I suppose support is accessible, timely and person-centred, and that was very much agreed and very significant. We'll go through in terms of the principles and different tiers of levels of support, but interventions are evidence-based and outcome-focused, which is really, really important. And that services are coordinated across levels of care. And I suppose that build in resilience and coping capacity as well. So it was really to capture what is our vision, and then I suppose that is informing as well in terms of embedding into the principles within the strategy. So yeah, there's various principles. So in terms of our clear vision and purpose, essentially, you know, the last slide there in terms of that's very key to look at that in terms of what is our vision and purpose. We have capacity building there, so even in relation to that principle, it's around, okay, looking at training roadmap for professionals in the organisations. And as Sarah Jane said, we done a piece earlier where I had linked in with some of the services around, okay, well, what level of training have the staff at the minute? What are maybe outstanding training needs to further develop and enhance service delivery within your organisation? Collaboration, I mean, that's key. That's across the board in all our organisations, and that's an integral part in our day-to-day practice. Evidence-based practice, so essentially that's looking at what evidence-based interventions do we provide at the minute. Do staff need support with accreditation around some of the evidence-based interventions that are being offered and delivered within the organisations? So again, some of them are interlinked in terms of, is there training needs there that maybe we need to look at? How can we best support your organisation? As Sarah Jane said, she touched on it earlier there, around the whole family approach. So in terms of our assessment, care plans, are we being mindful of the whole family approach? The hidden harm piece as well is very key to that. In terms of accessibility, I only had a conversation with Gary there recently, just in terms of our own organisation, in terms of enhancing and I suppose developing our own promotion within our organisation. And I suppose that's the question that we have in terms of our organisation. How can we better promote what we're doing in terms of the service delivery within the area, being inclusive? So can we do more? So really these are questions to promote, and really what it is to sit down and look at some of the principles which we're already doing, but how can we better maybe improve in terms of getting to that level of standard. And again, structured assessment and intervention. So looking at the documentation that we have, looking at our referral pathway, and I suppose embedding all these principles. But again, these principles are kind of an overarch in terms of some of the questions and actions that may come to light in some of your organisations that we could look into.
Michelle, can I just add something?
Yeah.
So these principles were put together in a framework. This is what services were already doing. So some services may have already achieved one of these principles. So within the standards, within the strategy, there's a list of standards under each principle, and we ask the organisation to consider where they are with that particular principle. Some of these people have already done, it's part of their service, it's long established, but some services that or some practitioners that had dual roles, they may be an addiction practitioner, but also doing a bit of family support. So it was just to have a more kind of seamless process for people to access services, and particularly if other organisations want to develop family support within their service as well.
So I suppose Sarah Jane touched on this earlier, the multi-layer family support framework. So particularly level 1 and level 2, most organisations are doing, and I suppose within this strategy, we all want to get to level 3 structured interventions, delivering evidence-based interventions, and many organisations are offering and delivering that. In terms of level 4, well, what does specialist family support look like? That could be family support therapists. That could be trauma care, very specialised interventions. Like ourselves in the task force, we don't provide level 4. We provide evidence-based interventions, so we're level 3. So it's very much recognising that organisations can provide a level of care, and what this really is to ensure that the level of support being offered is meeting the needs of the clientele that accessing the service. And as you said, each level responds to different levels of need and complexity. So this again, sorry, it's very, very hard to see and blur, but what we wanted to capture was, as we said at the beginning, over the last 3 years or slightly more, we as an implementation group have been meeting, and in terms of, so this is Sarah Jane who has been coordinating this piece. There was a number of services, including myself as a family support coordinator, involved in the implementation group to look at the different stages and develop this strategy. So we had Dublin 15, Drugs Task Force with Fingal families, ourselves, we had Ballymun Star, the North Inner City. You know, there was various organisations, but what I do want to very much stress was, and Sarah Jane did touch on this, we had service user representation, and that was at the heart of building the strategy, because having the insight and I suppose input from that level was just valuable, and that was a key part as well in terms of the implementation group. And really just I suppose a broader overview. Sarah Jane as the HSE Family Support Coordinator. We had the local drug and alcohol task forces. As I said, we had service user representation, ourselves meeting as a local implementation group. Service users are the heart of the community and the heart of everything that we do. So in the middle there in terms of service users. And the implementation group was feeding up to the national office, the general manager. So that's just kind of like a structure. Over to the other side, we touched on it there in terms of these standards have been informed by the likes of the Health Research Board, which many of us report into. So we report our cases into the Health Research Board, and that's been valuable in terms of, yes, we can agree there's more work that maybe we're a long way. Yeah, it's not going to happen overnight, but I suppose it's that long-term goal and to try and achieve is where the Health Research Board more changes come into play that would be more fitting in terms of us recording for family support. But there has been significant and very much welcomed changes already as a result. So that's just, I suppose, an overview of who's been involved, and having service user representation, as I said, has been key in the heart of this.
And just say that two blue boxes at the end should be green, because a big part of this was alignment, and so we now have family support coordinators in every task force area or leads, and the blue was vacant, and
the North Inner City
taken up on Tuesday, so as on Monday that will be great.
Yeah, very recent. So I suppose that family support referral pathway, and I think we'll all agree that needs are assessed collaboratively, appropriate level of intervention identified, and as I said in the previous slide, the different levels, level 3 being that structured evidence-based intervention, and referral pathways are clear and documented. So again, that would fall into the principle around assessment, looking at our own documentations within our organisation, ensure that they're clearly documented, and movement between levels is flexible and responsive. So I suppose applying the standards in practice, so in terms of what we're encouraged as family support professionals in our organisations is to look at, so review your current provision, and I think that's very important, because it's very important for us to reflect on our daily practice review and evaluation, identify strengths and gaps, develop local action plans, engage with implementation groups, i.e. yourselves, and embed this into our core service delivery. So just really to put that into in terms of on the ground. So the what next, we have our strategy, we have a framework now. And I suppose for me as a family support coordinator within Dublin 7, Dublin 11, Finglas, Cabra area, my hope and vision as well is to look at these principles in more detail. As Sarah Jean said, a lot of the organisations, the principles could be achieved, or for some organisations it could be one or two principles to really look at and support organisations where they're at. As I said, it could be something like training needs for organisations. So I suppose, as I said, the key to all this is going to be the ongoing collaboration, and I think we're all in agreement that's how best we work in terms of the collaborative professional relationships that we have in the area. And I suppose just some examples and questions that to come out in terms of looking at the principles more in depth is, like, how are we using evidence-based interventions to inform practice within our service? Are referral pathways and exit protocols regularly reviewed? These are some of the questions that we can reflect on, and I suppose, as I said, my hope after today's presentation and going forward is to bring this strategy, the document, to the local family support services in the area, look at the principles more in detail, and look at how best we can support in meeting the standards set out in the strategy. So in a nutshell, that would be my hope going forward, and that's not possible without collaboration with the local services in the area. And yeah, most people would have, that's my email address below. So really that's where we're at. Today was just about really letting you know where we're at 3 years later in terms of having this strategy, and hopefully you know, it's to work with the local organisations in the area and looking at these standards and to inform best practice and evidence.
Can I just share a lovely story that Michelle has achieved? When we were doing the Define piece, there was a gap within services in the North Inner City, and we've an integrated alcohol service in Dublin 1. So we know probably 30, 40 people say access that service, but there was no referral pathway for family members of the people using the integrated alcohol service, and Stanhope is part of that service. So there's a development piece happening there around Michelle, or Finglas Cabra family support, being the family support within Stanhope, and that's working out really well. It's only very recent, but that's the kind of the development and the achievements we've had over the last few months. So it was identifying gaps where there weren't services accessible to family members. We knew those people were using the services, so they have family members that could access services as well. So that's just like one of the key achievements that you've had.
Yeah, we've had growing intake of referrals, and just to add, I just want to say that we recently had Rachel join our team at the end of last year, at the back there, and Rachel we are delighted to have as a resource. So she is going through her accreditation at the moment in terms of the 5-step intervention, and as I said, with the growing referrals, Rachel is very busy now with the referrals that are coming in across the area and from different organisations, i.e. Stanhope and other organisations as well locally. Sorry, Michelle,
and that was another thing we were able to identify from the research, particularly the HRB study, was people who accessed services needed that extended brief intervention. So someone going into Stanhope, what they could be offered was episodes of counselling, and we knew that's not what all family members needed. They needed that level 3 extended brief intervention, which 5-step can do. So it was, you know, to being able to meet the needs of the service users and offer them something different. So it was pulling it all together.
And I suppose just before we wrap up, in terms of that 5-step, as I said, is I suppose that intervention to work with family members affected by a loved one's substance use, but also we also offer where gaming and gambling is added to that. So just for any organisation that maybe isn't aware of that, and that's even, as I said earlier, in terms of one of the principles, I only had this conversation with Gary, is around us, I suppose, enhancing our promotion piece and materials. And as I said, Rachel is on board now with regards to the 5-step referrals, which are growing you know, steadily, which is brilliant. And I suppose, to be honest, that's kind of allowed me to look more at this coordination piece locally. So I'll be dedicated in terms of taking this strategy, going out to the different organisations and sitting down and looking at how best we can support, because everyone's already doing brilliant work. It's where maybe organisations, some of the principals, they feel like, do you know what, I need a little bit more support with this, or how best can we achieve this together. So yeah, that's us, and we just want to thank you for your time this morning and listening to us, so thank you.